Dr. Schultz, today I thought we would talk about TURPS. Now, enlarged prostates are a big issue because the urethra grows through the prostate, and when they get enlarged, they put pressure on the urethra, and people typically have issues urinating. And oftentimes, one of the frustrations that I have when I see people having this issue is they're usually kind of in pain for a while, or the issue's starting to build before something actually happens to take care of it, and they're in a lot of discomfort. So can you explain a little bit about what BPH is, and then we can get into TURPS and alternatives?
Well, transurethral resection of the prostate has been around for many decades, and it is a way to compensate for the fact that as men get older, their prostates get bigger, and sometimes it pinches off the urinary passage from the bladder out the penis, creates slow urination or even seriously blocked urination and the more dire circumstances. And this procedure, the TURP, is a process where in an operative procedure, doctors go up the penis with a special type of a knife and they cut out the interior portion of the prostate gland, remove those pieces of tissue, and then by doing that, they open up a passageway for the urine to flow more freely. And this is a time-honored methodology. It's been around, as I said, for many decades, and it's quite effective.
Before I get to my next question, I just wanted to remind you that we're a nonprofit, and if you would like to join our cause, you can do so at pcri.org/donate. Now back to my next question on BPH treatment alternatives. When it comes to BPH, is TURP really like the best procedure? Is that the first go-to when you're having this issue?
Well, it's the most time-honored procedure. There have been many other alternatives that have been developed that are not as extreme. For TURP, you have to go into the hospital. You'll be there for a few days, and then there's a healing process. You'll have to have a catheter afterwards. And when they carve the middle of the prostate out, men, when they have orgasms subsequently, will have dry orgasms. I think for that reason there have been a lot of other popular alternatives that have been springing up to try and improve urinary flow without having quite as dramatic an operation to fix it.
So when I think about TURPS and I think about the concept of carving out part of the prostate, is scar tissue an issue at all?
I don't think scar tissue is an issue. I think that if people get through the operative procedure, they have to go through anesthesia and healing and whatnot. If everything seems to be in good order within a few weeks, then the long-term ramifications are not really problematic. There is this small incidence of complications anytime someone goes through any kind of operative procedure. There's never a risk-free visit to the hospital. But these methodologies have been very effective.
So what other alternatives are there to TURPS? We have microwaving, we have all sorts of things, but what would you say, with so many men in your practice and having this issue, what do you use the most?
Well, this issue comes up in men that have had problems despite trying different medications. We typically try alpha blockers or 5-alpha reductase inhibitors, Flomax, Proscar type medications prior to doing any kind of a invasive procedure, and those are often effective. But when they're not, then the next level of commitment that we usually think about is dependent on how big the prostate is. So men that have really large prostates, then we start thinking of a procedure called prostatic arterial embolization, where they, in an outpatient procedure, snake a tiny little catheter through the bloodstream into the prostate and squirt substances into the arterial supply to the prostate so that it blocks the blood flow. And then this causes the prostate to shrink over the next couple weeks. It's a nice procedure because there's no need for sedation, there's no need for catheters, and it's pretty effective in men that have substantially enlarged glands. Not everyone that has urinary symptoms has a dramatically enlarged prostate, and so men that are having urinary symptoms with smaller prostates, some of the popular options are things like REZUM, Urolift, and there's a new procedure out called iTIND. It's just like a little spring that just sort of pushes the urinary passage open.
So what type of side effects would be associated with any of those?
Well, let's start with the iTIND, which is this new device that is inserted through the end of the penis. So side effects, having someone manipulate your genital urinary tract is a side effect in my view, but if you look past that, the fact that someone's sticking something in a sensitive area of your body. iTIND, for example, will sometimes be a little uncomfortable when it's stretching the prostate out. This device is inserted for about a week, and then it's removed after a week. Urolift is another procedure that can be done in the office where they sort of pin the prostate open. The REZUM procedure, they insert a catheter in the penis, and then it shoots steam out laterally so that it causes some of the prostate tissue to shrivel away from the urethra and improve urinary flow that way. I think the main side effect is just going through the process of having this sensitive area of your body manipulated with different devices. Complications from these things like REZUM, iTIND, and Urolift seem to be pretty rare.
So one of the things that I've seen, because PCRI, our audience is looking for answers, and they're usually having some pretty complicated issues sometimes. One of the issues that I've seen pop up time and time again is that somebody has had a TURP and maybe they need it again, or they've had Urolift and they need it again. So would it make sense to continue to do the same procedure if it didn't work the first time, or would it make sense to do a different procedure if the other one didn't work?
Well, when we talk about it working, a TURP will usually keep the symptoms in abeyance for 5 years. And if 5 or 10 years after a previous TURP, the problems are recurring again, another TURP would be a reasonable consideration. Lesser procedures like the iTIND or the REZUM or the Urolift, I see oftentimes are not getting the same durable results that TURPs are getting. Some men can have protracted benefit, but it is also possible that they'll have difficulties again within a couple of years and have to revisit the same treatment or advance to another treatment. So it's a judgment call depending on how much benefit you got out of it the first time and how much discomfort and inconvenience it incurred the first time. So if it was a very simple procedure and it buys you a couple of years of relief, repeating it would be reasonable.
I know these are typically outpatient procedures, but is there any risk for older patients getting any of these procedures?
People have to consider that every time we go to the hospital, and if there's going to be a process of general anesthesia where they put you to sleep, there's always a small risk of something really terrible happening. And that is generally why I want to use either less invasive procedures or medications as first, second, and third steps, and then reserve hospital procedures for situations where those initial steps were ineffective.
Would any of these treatments have, cause issues for people who have prostate cancer, or do certain treatments not mix well with other BPH, treatments?
No, I don't think there is much of a concern. The men that have low-grade cancers are under observation, and if they had to undergo a treatment to improve their BPH, I don't see any complications or contraindications. Men that have more consequential cancers, this comes up sometimes as an issue for men who are contemplating undergoing some form of radiation. Transurethral resections are fraught with more complications in men that have previously radiated prostate glands. So if people are embarking upon a radiation treatment for prostate cancer and they have pre-existing prostate enlargement and urinary flow issues, the experts tend to think that you want to take care of this large prostate problem first, perhaps do a TURP prior to the radiation, rather than after the fact, sometime down the line, encountering urinary difficulties and then trying to do a TURP in a previously radiated prostate. Radiated tissue simply does not heal well, and undergoing a TURP in someone who's had previous radiation is much more fraught with problems and certainly increases the risk of developing urinary incontinence.
Is there any procedure that you would specifically choose for that patient then?
Treatment still has to be individualized depending on the size of the prostate, the severity of the symptoms, and the willingness of the patient to undergo a more extensive procedure, possibly with better results, or a more minimalistic procedure with less initial side effects.
So today we talked about BPH, we talked about TURPS, and then we talked about TURP alternatives. Now, Dr. Casey Dow is an expert in his field, and he did an extensive conversation with Dr. Mark Moyad from the University of Michigan. And you can go ahead and click the link in the description below if you would like to watch that talk. It's very interesting. They're bringing up lasers, which is called HOLEP, and how to treat BPH. And so that's more of an extensive talk. This was more of an overview. But the overview is important because there's a couple key points I want to bring up here. Number For one, it's really important that you pay attention to who does the procedure for you. Make sure that you know all of your options, but go ahead and ask, the treating physician, okay, how many have you done? Read the online reviews, see if they've done any papers, any research in the area, and see how well-rounded they are in the subject. The person who does the procedure, if they're really good at what they do, they can help you avoid any pitfalls that can happen with the particular procedure and help you get over any sort of side effects because they're going to know the ins and outs of the treatment very well. The other things that you can do is definitely know your options. Like we talked about in this video, it's good to compare and kind of contrast, like, this is what I'm looking for, this is what I'm not. These are the previous treatments I've had to my prostate, and this is the issues that I may have, whether that's radiation or anything else. And it's good to know and be able to compare and do that with the physician as well. So talk to your urologist, talk about the pills, talk about, non-invasive things first, and then getting more invasive over time if the issue does persist. Another thing you can do is you can call our helpline. Our prostate cancer patients have had a lot of experience and training by our medical oncology team, and they can help answer your questions. The main point is that they give you information so that when you walk into that doctor's visit again, you're empowered with information and the right questions to ask, and they help you kind of think through the process. So you can go ahead and contact them at pcri.org/helpline. Now, thank you so much for watching this video. We appreciate that you trust us. If you would like to donate, you can do it so at pcri.org/donate. But please remember, most of all, you're not alone. If you need help, please reach out to us. Please get the support that you need. We appreciate you, and I hope you have a great week.